Hello everyone and welcome to my weekly vlog. I hope you're all getting a chance to enjoy these early days of summer, even if this is a summer like we've never had before because of the ongoing pandemic. Although COVID-19 has turned our personal and professional lives upside down and inside out, here at AHS I think we're doing our best to take the upheavals, challenges, and changes in stride as we continue to provide Albertans safe and high quality healthcare. This is a credit to all of you and your distinct contributions to our coordinated response. Today, I'd like to speak with a group who's been responsible for coordinating all of our COVID-19 efforts. And of course, that's the Emergency Coordination Center, or it's commonly called the ECC. We chatted about ECC in my vlog in early May, but as we move further to relaunch, I thought it would be worthwhile to do a follow-up. For background, this ECC was established in January, more than a month before the first case of COVID-19 was confirmed in Alberta. And since then, our ECC has continued to be the brain center for our pandemic response, overseeing our actions across all portfolios throughout the province, as well as with government, the executive leadership team, and our many other partners. Today, I'm joined by 4 guests to talk about what the next few months have in store for ECC. So they are Cheryl Bourassa, who's the Executive Director of Emergency and Disaster Management, Tom Watts, Director of Emergency Disaster Management in the Calgary Zone, Chris McKiernan, Director of Provincial Strategies and Performance with Emergency Disaster Management, and Samantha James, Analyst of Public Health Surveillance and Reporting. So welcome to all of you, and thank you for joining me today. So Cheryl, let's start with you. I know that there's no typical day in the ECC, but at this stage of relaunch, what are some typical activities within the ECC, and what are your main areas of focus?
Thanks, Verna. You're correct by saying there's no typical day in the ECC for sure. The ECC activation for COVID-19 has been somewhat different from any other activations that we've had in the past. From the initial time we activated back in January, the positions in the ECC have been filled by individuals who have worked on the site, but also virtually, and that's what's really been different about this activation, is that we really used a hybrid model for on-site and virtual workers to staff the ECC. That arrangement has really enabled us to maintain compliance with the public health measures of social distancing, limiting the numbers of people in the center, things like being able to manage temperatures on entrance, enhanced cleaning protocols, and all of those kinds of things. In late June, we did transition the ECC to a fully virtual activation. Several business units at that time did return to normal operations, and with designated contacts for the ECC that was continuing to function. Other program areas such as public health, addiction, mental health, and Indigenous health have remained really active in support of a continued response. As you all know, that there continue to be outbreaks in some of those communities, as well as the aftermath and addiction mental health issues that are continuing to be planned for, and certainly public health and the contact tracing that has increased for them, and obviously planning for a potential vaccine coming in the fall. At the present time, the focus of the work in the ECC is really at a high level, is providing ongoing oversight for the COVID-19 activities in Alberta. That's being accomplished with designated ECC leadership. We also have an intake email line that's staffed Monday to Friday during business hours that takes in all issues and concerns or questions from various groups, both internal and external to AHS. We continue to manage through our incident management operating system on SharePoint, the dashboards that are continually being populated, documents, and the ongoing action plans of the various areas that are continuing to work to improving our response from our lessons learned in the initial part of this response moving into the new year, or into the fall of this year.
Great, thanks very much, Cheryl. Tom, have you identified areas of improvement before a possible second wave of the virus?
So throughout the response to date, we've modified our documentation process at least twice to be more user-friendly and meet the needs of our staff overall. To that point, I mean adding the taglines so that you've keyword searches. The McKinsey search where they were looking for a lot of our documents, specifically with our critical care plans. When we had to go looking for that at the time, and some of the documentation that was being asked for didn't match up with the naming convention of the actual documents itself. So we had a hard time finding very rapidly some of those key pieces of information, the documentation that we had been created that we were looking for. So EDM uses continuous improvement throughout our day-to-day operations, and that one issue of looking for something and couldn't find it, we immediately sort of tried to bring some key groups together with policy, legal, our own group within the ECC, who is responsible for sort of the planning and the documentation control. So we did an awful lot of work to make things more user-friendly, just because of that specific request to find documents for McKinsey. But overall, again, whenever we've had better comments that people think there are ideas that may improve the process, we've tried to incorporate that into our documentation. So it's easier to find the documents, easier to find who actually helped create them and who was involved in them. So yes, definitely a lot of lessons learned actually coming through.
So moving over to you, Chris. HS is not really seen as a nimble organization, as we know, but you know, at the end of the day with the ECC, there were many decisions that were made quickly every day. So I want you to share with us, how did you manage to expedite decision making while also at the same time making sure that government, stakeholders, and at our executive level, that we were all looped in the process?
So I think the answer to this is that we implemented the Incident Command System, or ICS, which is really transitions the organization from a committee and consensus sort of approach more to a command and control approach. So you know, I understand that that is not really a good cultural fit with the organization or with healthcare generally in sort of normal circumstances. But in terms of incident management, it allows us to sort of implement policies, make decisions, update documents far more quickly than we would otherwise be able to do under normal circumstances. So very much a sort of an incident management tool that we implement when we need to. In terms of stakeholder engagement, I think that's a bit of structure and process there. So, certainly externally, a bit of a structure answer. I mean, we have in the ECC the liaison position, which is, as the name suggests, is the point of contact through which information flows both ways to government and to municipalities and to other external agencies. So lots of engagement through that position. Internally in the organization, it's a bit more process driven, I think. So we have a series of formal meetings, really what we call part of the operational rhythm of the incident. So we have a very close relationship with the ELT through the ECC director and the deputy directors. So lots of engagement there, particularly with Deb Gordon and Dr. Braun. The ECC command team meets regularly with the Ministries of Labour and Health and with FNIB. And then the ECC team itself meets regularly with the zones, not just the ZEOCs, but also the chief zone officers and the zone medical directors as well as some members of ELT. So all in all, through those sort of two structure process pieces, there's an awful lot of consultation, input to decision making, but it happens very quickly. I say right up and down the organization, involving all key stakeholders. Great,
thanks very much. Samantha, I'm going to move on to you next. As I mentioned in the introductions, you're an analyst of public health surveillance and reporting. Can you describe to us your role and tell us a bit about how your work meshes with the work of ECC?
So as an analyst for surveillance and reporting, the main purpose is to basically ensure the ECC and leadership has the most up-to-date information as possible, so you can make informed decisions around the care in Alberta for COVID-19. So the primary way I do this was by building and maintaining the COVID-19 surveillance dashboard. So this product uses a lot of information from various sources and integrates the data to provide a cohesive picture of what's currently happening in Alberta. So I can provide as real-time data as possible to the ECC, So this includes things like number of cases, number of hospitalizations and ICU admissions, sadly the number of deaths that occur because of COVID-19, and basic characteristics of cases, testing locations, etc. And then additionally, using the fantastic work from the other EPIs and analysts on my team, we have other products that allow me to let the ECC know what's happening for the various outbreaks in the province. And then both for myself and for the other analysts on the surveillance team, our job is to always be there to respond to any urgent data requests the ECC or executive leadership team may have, so they can use the most up-to-date information possible to make those informed decisions. And then once those decisions are made, we can let them know what the outcomes of those decisions are.
Great, thanks very much, Samantha. Moving over to you, Cheryl. The ECC has introduced several task forces during this pandemic. Maybe describe to us what some of the key ones have been, and how does their work align with what ECC needs to do?
Yeah, Verna, for sure. There's been a number of task forces that have been created throughout the response, and I'm certainly not going to do them justice today in the discussions, but we'll focus more on some of those that have remained active as we speak now. Perhaps I'll start by just explaining a little bit about the task force in the context of Emergency Coordination Center operations. In Alberta Health Services, in our ECC, we utilize, as Chris mentioned, the internationally recognized emergency management organizational structure called Incident Command System. Task forces are a really integral part of that system and are utilized to expand the functionality of the ECC. So when we have those really more complex areas of tasks that require a combination of resources and expertise, we assemble them to support that specific operational need. The task forces have designated leaders, and they are linked in and aligned to the structure within the incident command system. So they are very much part of that overall chain of command and stay very well connected to all the areas of within the ECC itself. As I said, we had a number of task forces that were formed. Some of them demobilized once their work was completed. Others have continued on as we've transitioned into more of a virtual ECC. The Indigenous Health Task Force is one of those. They're very instrumental, or were very instrumental, and continue to be very supportive in the development of zone-based committees that involve First Nation community leadership, zone operations, population, public, and Indigenous health, First Nation Youth Health Branch, and others as well. That group has done phenomenal work and continues to support those communities. That we had a vulnerable populations task force as well that has continued to be active. They were really charged with addressing issues that related to the physical distancing and isolation of the shelter populations. Again, very incredibly complex challenges, numerous operators across the province, a population with some very distinct needs to be addressed. And so again, this group has been really, really beneficial in supporting our provincial approach. And again, working with other organizations, the shelters, the operators themselves, but also with government. As I said, I certainly can't do this justice, Verna, because there have been so many task forces and just have done some amazing, amazing work for us.
Great, thanks very much, Cheryl. So Tom, the ECC has been operating now for more than 6 months. Can you share with us what have been some of the key learnings?
Sure. One of the first ones has just been the pre-deployment training for our staff. So Verna, back at the fall of last year, 2019, you worked with our team and we set up training sessions for a lot of our senior leadership back in October, November. And we did a fair number of staff went through that training, a lot of our senior leadership. But this response, being for the longevity of it, has really identified the need that really more training to go out to a lot of our senior leadership of staff that would fill some of these key Emergency Coordination Center or the ECC positions. That was one piece of it, just the training aspect of it. There's been some broad involvement that has come out, and I look at the Indigenous health teams now. From the zone perspective, the First Nation community provincially, the network and the connectivity that's been set up has been amazing now that they're sharing that information across the province. I spoke earlier about just our documentation process and the lessons that we've learned through there. We've created an incident management operating structure that allows us to keep all of our documentation online that we've learned from previous responses, that they really, when we have been audited, they're looking for that documentation trails on how we're actually doing that. And now with the incident management operating system, that information is captured in real time for us, and now it's readily available at our fingertips as to why some of the decisions have been made. From the retrospective review that we just finished as the beginning of June, we did find out that within our incident management system and the incident command system that Alberta Health Services utilizes, that right now a lot of our staff are really impressed with the speed to which some of that decision making is actually made, and we can produce some of this documentation or directives, guidance documents, and get it out to staff in a very short turnaround time.
Great, thanks very much for that, Tom. Chris, how might the ECC's work change as AHS and the province moves further into relaunch?
Yeah, I think to a great degree, we're probably already there in terms of the sort of the care and maintenance mode that we're already in. I mean, I mentioned earlier a series of meetings. I mean, those meetings, for example, were held on a daily basis. Now they're held on a weekly basis. The number of people filling official ECC positions has reduced drastically. We're now on what we call sort of ECC skinny. For example, I mean, at the height of the incident, there were probably about 50 plus positions established and staffed in the ops section. Now there's probably no more than half a dozen of them. That said, of course, the work is ongoing. And we are still very much, rather than sort of creating new policies and documents and processes, we're very much in sort of the maintenance mode. So we tend to be updating those as the situation changes and as we learn more. And a good example of that, of course, is the relaxation of the visitor guidelines recently and so on. That all said, of course, the ECC is very much part of the all hazards structure. It's an all hazards structure, part of the all hazards process piece. And we can be established to support other types of incident as well. We're probably out of the flood season, and I do have my fingers crossed actually at the moment, but we're very much into the fire season at the moment. And there's been a significant amount of thinking and planning for some time now as to how the ECC will support Wave 2 of Connect Care, because we will be supporting that Wave 2 rollout. Our big concern there, of course, is that that rollout may well coincide with a potential Wave 2 of COVID. So we could potentially find ourselves managing two significant incidents simultaneously. So that's at the back of our mind. But I think in answer to your question, we're probably on our sort of care and maintenance mode at the moment, although the work, of course, is very much ongoing.
Great, thanks for that. Samantha, has the information needs of the ECC changed as we move further into relaunch?
Yes, the information has definitely changed. Early on, the focus was more on immediate things like the number of cases, number of hospitalizations, deaths, etc. And while these things are still extremely important, now that we have the opportunity to look at more refined data, there's definitely increased interest at looking at things like creating risk profiles for those who have more severe outcomes versus those who don't. And especially with the relaunch and shift towards asymptomatic testing, there's a lot of interest from the ECC to know how many asymptomatic tests we've found where they've been positive versus negative. And then there's also an interest in early detection of outbreaks. So we can catch these clusters a lot sooner than normal. But essentially, the further we move into relaunch, information around early detection and identifying areas with higher likelihoods of outbreaks or poor outcomes is going to become extremely important. So we can help mitigate any effects from the second wave that we're anticipating. And it'll also be interesting to see how that coincides with the next flu season that we have later this year.
Thanks very much, Samantha. So I've got a final question for all of you, because we know that COVID-19 never takes a day off. So how do each of you find time to get away and recharge? So Samantha, I'm starting with you first.
So I am lucky to have a very active dog. I mean, some people might not say that's lucky, but he forces me to just find any kind of time I can to get outside with him, take him for on hikes, do any sort of outdoor activities with him, especially when the weather is good, because it's been very rainy lately. So I'm lucky to have him to force me to get away from my desk after spending all day there.
Wonderful. Chris?
Well, I've learned to ride a unicycle, so I'm sort of occasionally out on that on an evening. But what takes up more time is I play bagpipes in a pipe band. So I am frequently in the basement of an evening practicing my tunes. So I've just got to give my wife a shout out, who's very patient and has an expensive pair of ear defenders.
Tom?
Very similar to Samantha. I have a four-legged companion Wilbur that does take up an awful lot of my time, but we like to camp, and being able to get out camping here last week was something that we really enjoyed. And then with the new use of Zoom here, my father-in-law is actually working very well compared to the phone calls when he can actually see us talking to him. So it makes a lot of difference that way. But that's how we're staying connected with family and friends.
Last but not least, Cheryl.
I have quite a nice large yard, and I love gardening, so I do that's kind of my downtime. I do enjoy reading, like the others, lots of Zoom calls. I have to say I desperately miss the activities of my grandkids and being able to watch all their sports and things, but it's always great just to be able to connect with them. And I drive over and take them a banana loaf, and we talk from the curb kind of thing still. So still haven't fully re-engaged the whole family, but really looking forward to that time.
So thanks to all of you. This has just been a wonderful discussion. I have to say I really miss the daily updates and hearing your voices every morning, but I'm kind of glad we're in a maintenance phase. We've already had a flood, we've already had some wildfires, and now a pandemic. So I hear that bad things only comes in three. So I think we're done now for the rest of this year. I really want to thank you for joining me today, and I want to thank everyone who contributes to our ECC, our ZEOCS, and our other coordinating bodies. There's just been so much work related to COVID-19 that happens every day at AHS. And because of that, it's important that our efforts are always well coordinated and recognized. The fact they are is one reason our pandemic response has been so effective to date. So next week, we're going to speak to another group that's been on the front lines of this response, and that's our people at HealthLink. So I really look forward to that discussion. In the meantime, please take care of yourselves, each other, and the ones you love. Stay well. Thank you for all that you do, and I will see you next week.
Together, we do amazing things every day.